Hi, I'm Dr. Zal, and the topic is hydronephrosis and hydroureter. Hydronephrosis may define as dilation of the renal pelvis, ankylosis associated with progressive atrophy of renal parenchyma due to obstruction of the outflow of urine. Whereas analogously, hydroureter may be defined as dilation of the ureter. If hydronephrosis is allowed to progress, the functioning unit of the kidney are destroyed. The collecting tubules dilate and muscular walls of the pelvis and ankylosis stretch and replaced by fibrous tissue, eventually form a large fluid-filled functionless sac. Hydronephrosis can be classified by grading system into 4 grades and clinically into minimal, mild, moderate and severe forms. So grade 1, that's also called the minimal hydronephrosis, is the dilation of the renal pelvis, no callosal dilation. Grade 2, that is also called the mild hydronephrosis, that is the dilation of the renal pelvis, mild ankylosis. Grade 3, that is the moderate type of hydronephrosis, there is the moderate dilation of the renal pelvis, ankylosis, blunting of pharynxes and flattening of papilla with mild cortical thinning may be seen. In case of grade 4, severe hydronephrosis, that is the gross dilation of the renal pelvis, ankylosis with loss of borders between renal pelvis, ankylosis, and renal atrophy seen as cortical thinning. The presence of hydronephrosis or hydroureter can be physiologic or pathologic. It may be acute or chronic. It may be unilateral or bilateral. It can be secondary to obstruction of the urinary tract, but it can also be present even without obstruction. A multitude of causes exist for hydronephrosis and hydroureter. Classification can be made according to the level within the urinary tract and whether the etiology is intrinsic, extrinsic, or functional. The etiology and presentation of hydronephrosis and hydroureter is variable with age. In neonates and children are likely as due to urethral valves, strictures, stenosis at uretrovesical junction or at uretropelvic junction. In comparison, calculi are most common in young adults, while in the older patients, the prostatic hypertrophy or carcinoma, retroperitoneal or the pelvic neoplasms, and calculi are the primary causes in older patients. Hydronephrosis or hydroureter is a normal finding in pregnant women. The renal pelvis and callosal system may be dilated as a result of progesterone effects and mechanical compression of the ureters at the pelvic brim. Dilation of the ureters and renal pelvis is more prominent on the right side than the left side and is seen in up to 80% of the pregnant women. Symptoms vary depending on whether the hydronephrosis is acute or chronic. With acute obstruction, Pain is frequently present due to distension of the bladder, collecting system, or renal capsule. Pain is typically minimal or absent with partial or slowly developing obstruction. In comparison, relatively severe pain, renal or ureteric colic may be seen with acute complete obstruction, as with ureter calculus. The site of obstruction determines the location of pain. Upper ureteral or renal pelvic lesions lead to the flank pain or tenderness, whereas the lower ureteral obstruction causes pain that may radiate to the testicle or labia. Bilateral symmetrical hydronephrosis usually suggests a cause related to the bladder, such as retention, prostatic blockage, or severe bladder prolapse. Long-standing hydronephrosis and hydroureter may be associated with obstructive nephropathy and renal failure. Patients with complete or severe partial bilateral obstruction also may develop acute kidney injury or chronic kidney disease. Urinary stresses may result in infection, renal scarring, calculus formation, and sepsis. Hypertension is occasionally induced by obstruction. Thanks for watching. Please subscribe for more videos and updates.